And we all know we've all been diagnosed with something, multiple things. Between the three of us, we've had a lot of conditions, and that brings on shame, right? To be part of a system that there's all this medical terminology around, and like to just, it's really so layered. And without the right tools, these kind of things is what take people out.
Also, if you add on to that, that when you go to a standard practitioner, they're like, are you sure? You know, there's a lot of people that question it, or like, are you sure you're really feeling that pain? Because we've done the test and we don't really see an answer. And are you making it up? Maybe you're just emotional, maybe blah, blah, blah. And that adds to the shame too, of like, something's wrong with me. And something feels wrong with me, literally, but everyone's saying I'm fine. So maybe it's all in my head. Maybe I'm doing this to myself. Maybe I made myself sick. And yeah, that's not helpful at all.
Oh my God. There's so many layers of shame there, right? There's the gaslighting and the distrust in yourself. And there's so many times too when I have that exact narrative go through my head. I did this to myself, right? That plays so loud when I'm feeling sick, especially when you couple that with like a history of disordered eating, or like you said before, both of you mentioned like substance abuse and oh, I must have done this to myself. My behaviors did this to me. I'm broken. And then the language, Jen and I were talking a little bit before this recording about even just saying stuff like your body is attacking you and what kind of relationship that sets up for you to have with your own body when you're talking about it that way versus like it's one of the reasons why we took the disordered off of CPTSD because it's not really disordered.